Alrighty.
Hi, I'm John Johnson, and this is my friend Sarah. We're going to talk about anatomy today. Before you start using your massager, I want to have a little bit of an overview of how we're going to be approaching the body. A lot of it is going to be reference to Thomas Meyer's work, Anatomy Trains. The idea being that the whole body is connected, just like a train. And when you're working on the upper body, the lower body is also involved. So a lot of times when I'm starting to work with a client and they've got really deep problems in their neck and shoulders, I might actually start working with the feet. So I'm just going to give a basic overview. We'll do the lower body first, and then we'll do the upper body in the next video. Starting with the feet, in an ideal posture, we're going to talk about ideals. Nobody's ideal, but this is a healthy, functioning woman who's does simple practices, maybe a little bit of yoga and some massage, and this is what we have. So her feet in an ideal situation are pretty much parallel to one another, right underneath her hips. The toes are long and straight. What happens with shoes is almost all of us have this problem. The shoes are designed not for our health, but for basically protecting us from the earth. And what happens is, my shoes are actually pretty wide, but most shoes squeeze the toes. So almost everybody, their little toe, if you look at your toes, your little toe is probably scrunched up against your fourth toe. So we'll be working on getting some spread and space in between the toes, and some other issues around the feet. Feet are really important. They're the furthest thing from your heart, furthest part of the body from your heart, which means circulation is a real issue. People with diabetes and other circulatory issues, sometimes they can't feel their feet, and very often they have kind of things going on in the bottoms of the feet that they're not even aware of. So keeping the circulation alive and healthy on your feet is really important. Then we'll move up into the calves and the front of the leg. There's a bunch of muscles on the leg that we'll be working with. You got the lower leg, and then you've got the knees. So if you could just sideways for a second, Sarah, so we can get a side posture here. The knees are really critical. People have knee problems. Now, the knee problems very often have to do with the muscles that are connected to the knee. It's not actually the knee that's the problem. It's all of the muscles that connect on the bottom and the top into the knee. And if you can work those muscles, as soon as you feel anything going on, your knees will be fine. I'm 62. I'm still dancing. Whenever I have a knee issue, I go right in there and take care of it. As you can see, her posture, if you had a plumb line that went straight up and down, pretty much from the ears down to the shoulders, through the hips, the knees, and the ankle, there's kind of a straight line there. And but it's not straight. In other words, the human body has curves to it, but all of those points are lined up on top of one another. That's what we're looking for, is a healthy posture, and healthy posture leads to relaxed muscles. So then we'll move up into the upper leg. Mostly the muscles in the legs are called the quadriceps and the hamstrings. Quadriceps for 4, quad means 4. There's 4 muscles in the front of the leg. Hamstrings, there's 3 muscles in the hamstrings actually. And then we move up into the gluteal area, the butt, most of us call it, and there's really important muscles in the gluteal area that have an effect on the lower back. So lower back problems, which many of us have, actually have 3 muscle groups involved. 2 of them are underneath the back. It's the gluteal muscles, and so there are stretches for that and massage things that we can do. The hamstrings, and then the psoas muscle. Psoas muscle is really deep. It's really deep. I'm not even, you take out an anatomy book. I highly recommend getting a book where you can look at these muscles so you can actually see what's underneath the skin. Psoas muscle is really deep. It's hard to get to. There are some stretches for it, but those 3 muscle groups are critical to the health of the lower back. So once again, lower back issues, you don't go into the lower back to get rid of the issue. You have to do all of the muscles that are attached to the lower back that cause the pulling and tension that causes the pain in the lower back area. So that pretty much covers the leg area.